My name is Sheila Bailey and I manage Peninsula Healthy Living, a healthy living centre. And it's wonderful for us to see that spring is becoming more widely recognised. Peninsula Healthy Living, we've already been supporting communities to improve their health and wellbeing for many years. And that's connecting them to a wide range of supports, social supports, physical, emotional, practical supports, all within their own area. Peninsula Healthy Living is one of 28 healthy living centres, and we're spread across all of the trust areas. Collectively and individually, healthy living centres, we have developed the services and the supports that people need within their own communities, and that's been identified by needs or gaps. No matter where you live within the South Eastern Trust area, we have a healthy living centre that can deliver spring. There's Peninsula Healthy Living and we have Healthy Living Centre partners, so wherever you are, you will be connected with a spring service. The Spring Social Prescribing programme specifically helps healthy living centres to connect our clients to the activities and the programmes that actually we're already operating. Many of them are internally within our own organisations, but there's also lots of other things going on with other groups out within the local community. I really do hope that social prescribing becomes a way of life and that this model can become sustainable. As a manager of a healthy living centre, you never know what's coming day to day, and of course we all try to plan our work. Never ends up that way, because typically this is about life. This is about real people coming into a healthy living centre with all types of concerns and issues and problems. And while we have many scheduled activities and we're very structured in one sense of the word, often a day throws things out that you would never envisage. Spring benefits clients by connecting them to what already exists in our local community, and it's simple things. It's the things that are already here, and being aware of the countryside, the lovely community assets that we have, the buildings, the structures. It's a beautiful surrounding. There's all sorts of ways that we can connect people, little walks, do a little bit of physical activity, come into a little social group, use the facilities that are all about around us. It's the simple things in life.
I'm Sarah Huggett and I work for Peninsula Healthy Living as a social prescriber. I cover the Newton Ards and Bangor area and job share with a lady called Kathy who covers our Ards Peninsula. Well, from picking up the referrals coming in from the GPs, getting them put onto the system and looking at the needs that they have, making contact initially with the client to see when would be a good time to meet up, where we can complete our initial assessment, and from there we will follow up with an appointment to see what's best going forward. Social prescribing really does give people an opportunity to meet new people, feel less isolated and lonely, particularly in our rural communities, but even in our urban areas where it's built up, you still feel alone and isolated. People with chronic conditions or who just need a little bit of reflection and perspective, then we can meet up with them and help to achieve that. So with social prescribing, you're looking around from the point of receiving the referral, a 2-week at most wait. So we'll have made that first initial contact with you to arrange an appointment, and based on your availability, we will come out to see you or meet you in one of our centres. So really the waiting list isn't particularly long, and we will always make contact with you within that first 2-week period.
My name is Dr. Bell. I'm a GP in Lochview Medical Centre. I've been here for approximately 3 to 4 years as a GP partner. Lochview Medical Centre already refers quite a bit to the Peninsula Healthy Living in Kirkcoven. We refer a lot of patients with mental health problems, anxiety, depression, patients with chronic pain, patients that would benefit from particular physical exercises, and in particular, given it's a rural situation, social isolation is quite a big problem, particularly with elderly patients. We have a referral form, but it's basically any of the doctors and our healthcare professionals can refer, including our pharmacists. So if we have a patient that we think would benefit from social prescribing, it's a very easy process just to chat to the patient about it, see what needs they require, and then forward a letter to yourself. Social prescribing, I think, is going to have long-term benefits for a lot of our patients. With our growing ageing population, poor lifestyle choices, the likes of diabetes, obesity, cardiovascular disease, are all things that can be corrected with social prescribing. And there's a rise in of anxiety, mental health, particularly in young people. Again, these not always respond to medical treatment, and the likes of social prescribing will be looking at the wider picture and I suppose the wider patient as well, the personality behind it. So the HealthWise programme is a physical programme where patients can get free gym access for a couple of months in order to improve their physical and mental health. And this complements the Spring programme as well, which is seen as a more holistic approach to managing patients through social prescribing.
Hi, I'm Tammy and I'm one of the managers here at Mount Stewart. So Mount Stewart is a National Trust property on the edge of Strangford Lough. It's a beautiful Irish country domain, a fantastic house, and acres, 1,000 acres of beautiful countryside to explore. So the National Trust is a charity, and as a charity it was established for the benefit of the public, for everyone. In fact, the sort of famous phrase that goes with the National Trust is that we are for everyone, forever, and that for everyone part is really important to us. We want to give access to as many people as possible to these beautiful places, and Mount Stewart is one of the most beautiful places, I think, in Northern Ireland. I think now, there's so much evidence that we are more and more disconnected from nature, and that is having an increasingly negative effect on our physical health and especially our mental health. And I think when you come to Mount Stewart, you have that lovely sense of reconnecting with nature. And that's something that we're very passionate about here, particularly at Mount Stewart. And I think because we have such a beautiful place, and we know that people really benefit from engaging with the beauty of that, pairing up with the Peninsula Healthy Living team at Prescribing has just been a no-brainer, a really natural partnership. So initially when we started working with Peninsula Healthy Living, it was just to see what does social prescribing look and feel like for us. How can we get involved with our neighbours, with a close organisation that wants to give people access and benefit to somewhere as beautiful as this. And initially it was just, can people just come here? So a 12-week free access pass was the sort of the social prescription that we offered. But I think as we've gone on, we've realised that there's so much more we can do. We all know that volunteering is hugely beneficial for a sense of belonging and a sense of well-being, and we'd really like to see how does that work? How can we offer volunteering opportunities for folk to maybe feel more engaged here? And what that does is it shifts the balance. It's not just about what can you get from Mount Stewart, but it's what can you give, and that's a lovely flipping of the narrative that we're really interested in exploring.